Oh, it's huge. It's huge. The potential is amazing. I'll give you an example. During the pandemic, we actually did with a variety of other institutions, we did a research that was looking at the number of children who were orphaned due to COVID-19. And the children who lose their caregivers are children who will have a higher likelihood of experiencing other adverse conditions, being subjected to violence, having issues by access school, adequate food, social support, um, and as a consequence, in some conditions, being more potentially subjected to exploitation of different nature, etc. So a very big issue. We actually published a manuscript, but we didn't stop there. We actually created a whole media strategy to document and to actually communicate this information. The whole media strategy was not only social media. Social media were tools that we use. Like we used Twitter, we used Instagram, we used Facebook, we used a bunch of additional social media. But this was jointly done with the National Institutes of Health of the United States, with the World Bank Group, the CDC, the World Health Organization. And so what we did several months in advance was to create a media strategy where the communications counterparts of each one of the organization, we actually met with them. We told them what the main messages of our manuscript were. We worked with them on the creation of visualization of information tools. So, how best to convey a particular message, either statically or dynamically, depending on the source that we were going to use. We work with the journal that was publishing the manuscript and their media people because they also have a communication. And as a consequence, we had an impact of thousands of outlets that actually replicated the information, and then millions of visits to the particular messaging that we had. Um, since then, and having learned from that lesson, we in the same group, we're working on other topics right now, but we have a whole media and communication strategy. As a scientist, one is not trained for that, and we realized, working closely with our colleagues from communications, that was essential. It was incredibly important, incredibly useful, because it taught us how to better convey messages that we want to convey. And then it helped us replicate that information and arrive to a wider audience. You know, having done that, we actually, some of us had the opportunity to talk in live television or in radio in multiple languages, to express and clarify our findings, to be interviewed by different people. And so that was incredibly important. But it started with thinking about a media and communication strategy for this. I think it's essential, and the impact you can have is astronomical. If you don't have that, if you just okay, here's my paper, here are my findings, I'll put them in a journal and I won't tell anyone. It's very, very different than if you have a complete communications and media strategy. And the purpose is not to have the strategy and say, hey, I'm here, I'm super famous. No, the purpose is really to actually be able to convey that information so that those who need to hear that information will actually act on it. And so the power of the media and using safety media is to actually transition from the information you have to action, to really elicit that attention of people and start conversations that can lead to action. It's incredibly important, and it is a topic that we take very seriously because of the potential it has, and because it's what eventually will change potentially the minds of people, and at least they'll turn around and see, hey, this point is important. We should do something about it. When you have a decision making person or institution react like that, that's when you start getting action.